Some big cuts could be coming to rural EMS providers across Texas. The Health and Human Services Commission is considering cutting the amount of money ambulance services can charge to Medicaid. Medics from across Texas came into Austin today to say those cuts would hurt them. KXAN investigative reporter Jody Barr was there. And Jody, they're worried about keeping the doors open.
Yeah, they are, Robert. And the reason is EMS companies are facing cuts to how much they can charge the government to drive Medicaid patients in their ambulances. The state's Health and Human Services Commission heard from more than 20 EMS providers from across the state this morning. Every single person who spoke asked the commission to not cut the Medicaid reimbursement. Some of the deepest cuts would come in an advanced life support ambulance fee. From $306 right now, that will be cut down to $247. EMS companies can charge Medicaid $258 for a basic life support ambulance ride right now. But with the proposed cuts, they could only charge $157. And any specialty care ambulance rides would be trimmed from $524 down to $347. All of these proposed cuts drew fire today from ambulance companies all over the state of Texas.
So how are we supposed to deal with a $1.14 million budget loss?
I will transport 911 patients in spite of these cuts. I will not continue to transport interfacility transports to get these patients where they really need to go. This will be the detrimental cost to Medicaid clients because they will not be able to get where they need to go because ambulance services such as mine can't take any more of those losses.
Now, some EMS companies in our area are already feeling the squeeze of potential cuts in what they can be reimbursed when they treat Medicaid patients. Just yesterday, we heard from Llano County that the EMS provider there is losing $450,000 a year on people they treat on government assistance. Llano County taxpayers spend about $150,000 a year on the ambulance service there right now. But with future cuts to those federal health care dollars, taxpayers there could be on the hook for up to $300,000 a year to fund a full-time EMS service. Health and Human Services, though, today did not make a decision on these proposed increases that could come by October the 1st. Now, obviously, if those federal tax dollars, Robert, are cut, the taxpayers of these counties will be left to foot the bill.
Important story. Jody, thanks so much.
Thank you.
EMS companies are not the only ones feeling the pinch from potential cuts to Medicaid. The state commission will also be looking at cutting how much they pay for substance abuse treatment programs, dental, radiation, nuclear medicine, and ear, nose, and throat treatments for people on government assistance. The state will make a final decision on those cuts by October 1st.